Well, we actually introduced a new product within Varian's portfolio back in 2004, which was a product we brought over from North America to manage specifically chemotherapy prescribing in the UK. A key part of that product is safety and decision support, and one of the areas that we needed to introduce into the product specifically for the UK was drug interaction checking and contraindication checking. So it was key for us to find a partner within the UK that we could use to provide the right tools, but obviously in the UK context to support the introduction of this product. So we looked at the available suppliers within the market space. It was obvious to us at the time that First DataBank were already pretty much setting the standard in the UK for decision support products and drug libraries of this type. And it was also obvious to us that with the support of the team at First DataBank that we were going to be able to provide the integration of the product into our system within rapid timescales, which was key to us in getting the product into the market. The real tangible benefit was really to be able to make drug interaction checking a fully integrated part of our solution and a direct product integrated part of the prescribing process. It was clear to us at the time that in order to be successful introducing the product into the UK market, we had to provide that level of functionality within the application. So I would even argue it was more tangible. It was a critical part of being successful in introducing the product and continues to be today. I think there are a number of benefits. I think that the first one is clearly being able to have data that is appropriate to the local context rather than global data that may or may not be appropriate to that context. I think the word I would really use to define the main benefit is that it's a partnership rather than a product that you supply that we just implement, and that's the nature of our relationship. And really our relationship with First DataBank from the start through to today has very much been of a partnership where we are very jointly sharing the same focus, which is to provide the best possible care for the patient. And that's come out very clearly from our partnership over the years. Well, I would say that consulting was a real critical part of the process for us, particularly when we were going through understanding how we would integrate the product into our own prescribing tools and making sure that we derive the maximum benefits from the tools that you were providing. And also, very importantly, when you're integrating one product into another, making sure that we weren't introducing risks that we weren't aware of, as well as resolving other clinical risks that we were trying to negate at the same time. So really working with you and working with consultants who really understood, A, the functionality that was available within the tools that you're providing, and B, how they should best be integrated was invaluable to us at the time. We have two very distinctive future plans that we are currently talking to First DataBank about. The first one is looking to use the First DataBank offerings for us more internationally. So currently we use First DataBank very clearly in UK context, but as a global organisation we clearly have a need for similar services internationally. So that's one area that we're exploring at the moment with yourselves. The second area as well is to work with you to increase the context sensitivity of the data that you provide. As you'll know, oncology is a very specific area of secondary care, and therefore the data that the clinicians require is very, very specific to the oncology context. And we know that's something that First DataBank are working on and something we're very happy to partner with you in as we move forward. The three pieces of advice I would really give would be, to start with, having a very clear focus on the objectives and the goals and making sure that they are focused on the patient, benefit to the patient and the benefit to the clinician, and make sure that those goals permeate the entire implementation project. The second thing I would say would be to then share that vision with the FDB consultants in order to ensure that vision is shared throughout the implementation, so that we're both driving to the same end goal. And then the third one would very much be to make the most of that initial consulting period in order to really harness the experience that First DataBank already have of doing these implementations, and to get as much right up front as possible in order to make the ongoing serviceability and implementation of the product much easier. Yeah, I'd be very happy to recommend First DataBank. I think that, again, the three key reasons would be, firstly, that the physical drugs database provides our users with the clinical information that they need. Certainly, the integration tools that were provided allowed us to integrate the drugs database relatively easily and quickly into our existing system, which makes it maintainable down the road. This is also an important part of the ongoing process. And thirdly, the relationship we have with First DataBank is more than that of a product supplier-customer relationship. It is really a partnership, and that's really what makes the whole thing work.